Welcome back to another episode of the Search Economy. I am excited for this one. Luke and I have been in the green room now for 16 minutes just chatting about all things. So we always have good conversations. I'm excited to bring them on to the Search Economy. But yeah, Luke, CEO and visionary over at PrimeHealth, local to my neck of the woods. Excited to have you on, man. Tell the people a little bit about yourself.
Yeah, man. Thanks for having me. So I started PrimeHealth with my wife, Sienna. She's our medical director, co-founder. She does all things medical, leads our medical team, and I run the business. So we started it in the beginning of 2019, just as us two. We're a functional medicine practice. So if people are unfamiliar with functional medicine I'll give just a very high level of what that means. So it's generally treating the root cause of illness. So looking at why something's happening and not just the symptoms. So using lifestyle and diet and super in-depth testing, and then a lot of different healing modalities to help them solve their problems for life. So we see all types of patients, from those with chronic complex illnesses to those that are probably more like you, that are generally healthy, and they feel good, but they want to feel great and they want to prevent future disease from happening. So that's what we do. We're a team of about 12. Our medical team is my wife. We've got a nurse practitioner. We've got a PA. We have two PAs, and then a dietitian and a health coach, and then support staff. So everyone on our team is trained in conventional medicine first. So, we can look at things like medication. We can manage that, but we also have a lot more training in functional and integrative medicine. So it really is the best of all worlds. So that's who we are.
I love it, and I dig it. Yeah, I've always liked the way you all do things, and especially the way you talk about it. I know Prime Health wasn't the only thing that you all did. Walk me through like how you guys came up with the idea and what that jumping off point was like.
Yeah. So there's a really long-winded answer for me to get there, but I'll try to expedite it a little bit. So um, I did my undergrad at the University of Wisconsin School of Business. I was going to go into business after that, graduated, and then I went on this totally random mission trip with my mom to, I've never told you this story, but I went to Nicaragua.
No, I was about to say I
Um,
don't know this one, so I'm
yeah,
intrigued now.
yeah, I went to Nicaragua, and what we were doing there was supporting this medical clinic. My mom's got no medical experience at all. I had nothing. I'd never even considered it, right? And so this was at the time when I just graduated. I was just figuring out what I was going to do next. I was looking at going into consulting, and I volunteered at this practice, and I started to see the real impact we were having on these people. And I had a huge kind of like oh shit moment of, I feel like I should be doing something else. I feel like I should be doing something more meaningful than potentially going into consulting. So did a lot of soul searching over my, like, whatever that was, week or 2 weeks that I was there. And then I came back and I decided to do a post-baccalaureate program. So I had never done any of the undergraduate science classes, ended up doing that at Columbia in New York. So that's what brought me out to New York City originally. I was planning to just live there for 2 years, take all these courses, apply, and then go to med school. But what happened was I finished Columbia. I was applying to med schools. I got into med school. I did all the interviews, the MCAT, everything. And during that time, during my gap year, I started working at what was a startup, which is now a giant company called Parsley Health. And they're the biggest functional medicine practice ever. I was one of their first employees. And that was my introduction to functional medicine. I had never even heard of it. I didn't even know what it was really when I applied for this job at Parsley Health. And then I had another 180 of like, shit, I know I want to go into medicine, but now I know that I don't want to go into conventional medicine. Now, while I think conventional medicine is super effective, right? I think it's amazing for emergencies and surgeries, right? But for things like chronic illness, in my opinion, it does a really, really poor job. And so this was another huge paradigm shift where I started seeing how their doctors were practicing medicine, and I realized that's where I wanted to go. And then I started thinking, okay, well, I haven't gone to med school yet. So I'm going to do 4 years in med school, at least 3 years in residency. And then I'm going to have to get experience in functional medicine beyond that. So realistically, we're talking 10 years until I have the job that I actually want. So then I had another oh shit moment. And it was a big decision to not getting into med school is hard. Deciding not to go to med school after you've got in, a lot of people were like, you are making a massive mistake, including my parents. My mom literally removed, she was like, I'm taking you off the cell phone plan. I was like, okay, that's. I was like, that's extremely petty, first of all, but whatever. And but so after that, what I ended up doing is I worked at Parsley for a little while, and I was running a lot of things for their practice. And so they're a functional medicine practice. We're a functional medicine practice. That's where I got my experience in running a practice, because that's really what I was doing. And I got so much experience there. Best of all, that's where I met my wife, Sienna. She's a medical doctor. She was one of their doctors there. There was a period when the founder of Parsley, Robin Burzen, wasn't. She was out on maternity leave, and Sienna and I were running the practice together. So we knew that we could do this. We knew we could work well together, but we didn't have a plan yet. After that, I left and I worked at a different medical startup that was called Friend Health at the time. They've changed their name a couple of times. Now they're called Common Health. They're a very different business now than what they were, but what we were doing is we were sending nurses into people's homes. So leveraging technology to allow people to book simple things like blood draws or like vitamin B shots or whatever in their home. So, and then after that, Sienna and I left New York City. I would have stayed longer, but she really pushed for us to move. I'm glad she did, because it was obviously we needed to do it. It's not sustainable. But we traveled Southeast Asia for 3 months, and during that time, we were putting together a business plan. We were looking at working on our website. We were putting together kind of like what our packages might look like. And then we moved to Denver and we launched PrimeHealth. So that was as quick as I could get through all of the
It's a
details.
good overview.
Yeah.
That's more, I knew bits and pieces of it, but I had forgotten that you got into med school and then backed out, which is it's such a good point. It's hard enough getting in, but leaving once you got in, or backing out once you've gotten in, is probably the craziest thing that anybody could think of, at least in that environment
Yeah, man.
context.
I mean, it is probably the biggest sunk cost, like sunk cost decision that you could have. Like, I can't get that time back, right? I already put it in. I already got in. But moving forward, like, what's going to make me happiest? That wasn't going to med school. So
Yeah, I mean, better to realize and make the decision later than never. I dig that, man. That's so. Uh, you have the different background in the startups. You've seen other places work. How is Prime Health different? Like, how would you say it's different today? I'm more so curious, like, what learning lessons you pulled, maybe which ones you didn't, to what you can say. I don't want to get anybody in trouble, but I think of my time at past companies prior to Numa. There are parts of Numa that I pulled straight from consulting jobs, but there are parts of Numa that I'm like, I would not mimic that system, that process, not even closely. Right? I'm going to do it my own way. So, yeah, I'm curious how it inspired, but maybe how it differed from what you're doing now.
yeah, for sure. So, I mean, in general, right? They're functional medicine. We're functional medicine. We're membership based. They also are membership based. Parsley Health, I'm talking about. And but what's different, and I have a lot of respect for what they've done. I don't want to badmouth them in any way, but um, they did a lot of things really well. I'll say that. But then they did some things that I think that we could do better. So they are a much higher volume practice. So like when Sienna was there, she had the most patients. I think she was at about 500 patients. And if you got 500 patients, you just cannot deliver personalized care, right? So what we wanted to do is we wanted to find a really good balance of a much lower volume. So our practice, each provider maxes out at about 100 patients. If you compare that to like a PCP has 2,500 patients, even a concierge doctor typically has 600. So we see way less patients, but what that allows us to do is to build a much stronger relationship with them. It allows us to really customize their plan. It's a super iterative process, a very reciprocal relationship, and we're constantly building and working together. And that's different from a lot of other practices, right? So if you've got a higher volume practice, you can do parts of that, but not all of it. So that was a really big, that's the key difference. With that, we're slightly more expensive, but my goal has always been for us not to be healthcare for the wealthy, right? I want to make this as accessible as possible. So we've really worked to get to a good place where I feel like we're accessible for a lot of people, not everybody, but we're still providing really personalized care.
Yeah, there's definitely levers you pull there of you want to make sure that what you're delivering is still quality and it meets the brand that you've built as well, which I think is important. But we battle with that all the time of I want to help everybody, but helping everybody almost puts us at a disadvantage. It means we can help nobody. So there's trade-off for sure. I hate that you brought that up though, yet right? people think of healthcare, but healthcare is definitely a business, broadly speaking. What you do is certainly a business. I know you more identified CEO visionary, have worked more on the business from a sales, marketing, things like that. I'm curious, what does your day to day look like?
Yeah, my day to day, I would say, changes all the time. Right now, we're going through a lot of changes, but it's mostly managing the bigger projects that we're working on. So we run our practice off of EOS, which I know you guys use as well. And so we have our big buckets that we're working on every quarter. And so overall, I'm kind of like I'm focusing on these bigger projects, right? But running a small business, a lot of things come up. So I'm constantly giving my input on sales for sure, marketing. I work on like the website with you guys. Any like patient fires that come up that I maybe have to chime in on, I'll help with. It varies quite a lot, and then there's like the random, super random things when you own a business that you do not think of. Like we own this building, right? I have a guy that was supposed to come yesterday to do all the weeds and stuff. He comes every 2 weeks. He didn't come, so I had to call. Like these little things
It's
that
the
you're that
little
you're
things that could eat away. I didn't know you owned the building, and that adds like a whole other job description to your plate as
Yeah,
well.
yeah, right. But overall, it's making sure that we're all moving towards our goals, and things are being completed. That people on our team are happy. I directly oversee the person that's in our integrator role. Our integrator, he's the one that oversees sales and marketing and admin. And so he and I actually share, and we share this office. So we're always talking until I get annoyed, and then I have to go in the back office.
You find your quiet space.
Yeah.
I don't want to divulge
Just
all your
just just
secrets.
kidding. Just kidding, Alex, in case you
Yeah, I was
listen.
gonna say,
I
Ali.
love you.
I'm gonna send it to him and tell him to listen to minute
Yeah.
12. Um, that all being said, day to day changes. You work on EOS, which I think this is interesting as well. I don't want you to have to divulge all your secrets, but what are some of those big rocks you're focused on? What are some of the big needles that you're trying to move this quarter? And I think even I'm selfishly asking, maybe as the vendor that helps you, what's forward looking for you all, even if we were to have this conversation this time next year.
Yeah, for sure. I think the one that we could probably talk about the most is just related to our sales and marketing strategy. So we're looking at a big thing we've been doing in all parts of our business is creating SOPs for everything. So making sure all of our processes are documented. And for sales, that means putting together a really robust sales playbook. I'm trying to bring on, like what I've been working on today is I'm trying to train and hire another salesperson. Um, and so that's a big part of how we bring patients in, right? So they book consults on our website. We do these chats with them. We discuss all their health histories, their goals, and whatnot, and we try to bring them in. So figuring out a way for someone to come onto our team and to be able to run that playbook over and over, that's something that I've been working on, just as an example today. But um, looking at our overall marketing strategy is something that we're trying to refine, and a big part of that is our website. So what we're doing with you guys, historically, we've brought in the vast majority of our patients from our website, as you know. But as you know, back in, I think it was November, maybe the
It's
of these.
November
Was it?
last year is when all the chaos started with the
Yeah,
algorithm update.
yes, exactly. So all these Google algorithm updates really tanked a lot of our traffic. Thankfully, from with your guys' help, we're trying to level that out. We're trying to focus more on local traffic, but with that, it really highlighted the need for us to have more channels for patients to come in. I think what happened with us is when things are going well. I know for me personally, when things are going well, I get complacent. But those are the times when I think you really need to push forward and you need to focus on what else you can do, because you notice, as a business, if you're focusing on just one channel being Google and your website, you're really fragile. And so we're trying to get this quarter, we're trying to put together a plan for how we can continue to bring in patients no matter if Google's doing well or not. Of course, we get a lot of referrals and word of mouth, but we need to strengthen those channels.
Yeah, and that's I was gonna say I remember when we first got connected. Shout out Eric Hinman and his sauna. Uh,
Yes, sir.
we got connected, we were talking about like, the usage of the website. And I remember you talking about like it's a big tool for SEO. And I think that's the one thing our team, we definitely work with you on, and work with everybody on, is the website's a tool a little bit for everything, right? Like any channel that you have. And if you've listened, anybody listening to this have listened to past podcasts, I think the one that probably is published right before this, all about how all those different channels work together, right? Like you can be really successful just with SEO, but you're putting all your eggs in one basket. If you layer in social and a few other things, not only can you be more successful, you're a little bit more diversified, and you have a good understanding of all these different channels, how they work together, and the impact that they can make. Um, but yeah, I know the sales and marketing rock has been big. I think obviously a lot of our clients are focused on that as well, but finding ways to really diversify. And I think we talked about it a bit as well. What are people actually buying? Because I think a lot of times service companies have a tendency to just sell their tactics. You can A, B, C, D, and E off a menu, but selling that solution, selling the vision, selling the plane ride, the destination, is definitely something that we hit hard on. And I think you guys have received well, but you were already thinking of long before us.
Yeah, yeah, for sure. I mean, it was crazy when we met you. Like, I had no idea you were going to be at Eric's. I pulled up with Alex. Alex had never been to Eric's. It just happened to bring him
Oh, I
that
didn't
time.
know that either.
Yeah, yeah. And we were literally talking about our website traffic and our website, like the design and everything. And then I hear you talking. No, actually, you know what?
It was
That was the
alive and
second time
well. It was the
yes, I met
opening
you. I met you
first.
first.
Yeah,
Yes, exactly, exactly. And then I walked in. I think maybe you were talking about web stuff,
probably.
and I was
Because we
like,
were
"This
doing some
is
work for one of
yeah,
Eric's like investments.
yep." And so it was a sign. Also, anyone that's down to get in the 220-degree sauna with me, I'm gonna probably
That
get
is
ridiculous.
yeah, that it's an experience. For those of you listening, we're talking about Eric Hinman. He has an episode on this podcast as well. You might have to go back a little bit, but super cool local guy to Denver as well. Luke, I think as you think of sales and marketing too, I'm going to say the word crowded because in my head it feels crowded, but how have you worked to differentiate yourself against all of the different options? But I might change the question on the fly, against the PCP, especially. Like I think traditional, I'm maybe on your team on side here, but like sick care, right? How do you differentiate between what I think people are used to buying and receiving versus what you actually do?
Yeah, for sure. I mean, we are very different. So I think a PCP definitely still has its place, right? We're always going to need a PCP. But what we do is quite different. So
I'd
if you
actually
look
be curious.
at
I'll pause you. Say more on everybody still needs a PCP, because now I'm scratching an itch, but I'm curious how you'd answer.
yeah, for why you think that?
Yeah, or why no,
Yeah,
why you
yeah.
think that? Yeah,
Yeah, well, because we don't do sick care, we don't do acute care. Like if you need, let's say like you need a vaccination or something, like we don't do that. We're not high volume enough to do that. And that's generally how it is with functional medicine practices. Like if you've got a sore throat, it's not going to be the place for you to go. Of course, like you could just go to acute care, so you don't technically need. Are you sorry? You could just go to urgent care. You don't technically need a PCP, but it does still it can still serve a purpose, like especially if you have to like checkups for your kids and stuff like that. um, but so I think it's still helpful, but generally people that work with us, they have to see their PCP way less.
which is cool. I mean, and like you said, it's the chronic versus the acute, which I think is a good way to describe it.
Yeah,
Another one I think is interesting. We had chatted about it. I know some of what you're doing on sales and marketing, actually a good amount by nature of the working relationship, but walk me through more of this partnership idea, because I'm excited to have you all come speak to the Numa team about functional health. And
yeah.
I'm curious how you think through that, not only as a sales and marketing tool, which I think it is and it's good, but also education tool of like how you tell your story and share its impact.
Yeah, for sure. So, we've done a number of these sort of things in the past, but it's something that's kind of been on the back burner. I mean, like I said, our website was doing really well, so we weren't really thinking about it all that much. But what's really important to us and our business is to have connections with organizations that we respect, communities that we respect, like you and Numa, like places like Archipelago, a community that we've been involved with for 5 years. And we love going out there and connecting with people and just introducing them to functional medicine, giving them any information that we have, so that they can understand that there's a different way to approach their health, right? Like a lot of people that we meet when we do talks like that, like they have no idea that you can look at things. It's a complete paradigm shift how we look at it versus maybe their conventional doctor, their conventional specialist. And what's great about doing that is, instead of like a consult call that we might do on the phone, which is one to one, this is one to many, right? So, we'll meet with your team and probably talk to like 20 people or whatever. And it creates really interesting conversation. We just like to get the word out there, and we're super passionate about what we do. So whether somebody works with us or with somebody else, obviously we want you to work with us, but it doesn't matter. Like, we just want you to know that there is a better approach. There is a way to be your healthiest self. And we strongly believe that that's through functional medicine, a functional medicine approach. I forgot I forgot the rest of your question. But
I think you, but mostly answered. It
yeah,
was more so just, yeah, how you think about it comparatively speaking.
yeah,
Okay,
yeah. It's just
yeah,
one
we
of the.
chatted.
I was just gonna say it's just one of the many tools, that we're using to bring awareness and patients to our practice. And doing talks like what we're doing with Numa is something that I think we're really going to prioritize a lot more. Um, Probably end of this
Yeah, because I
quarter.
mean,
We'll get.
selfishly for me, not even from like, I think you'll see some companies like want to do it from a productivity standpoint, but like I want my people to be healthy and happy, not to work better, but to have happier and healthier lives. Like I think that's something every company should want for their people, and stuff like that goes a long way because I don't think, it's definitely not always included in the working environment that people have. Like 9 times out of 10, a 9 to 5 is about work and job. Very rarely does a company get to bring some of that stuff in. So it's fun to build the team and build the culture that way as well. We chatted about a lot. We chatted your background. We chatted Prime Health, marketing, sales. What's got you excited for? Yeah, I guess we're nearing Q4. What's got you excited for the rest of the year and maybe next year?
Um, that's a really good question. Well, next year we're having a baby in the beginning of February, end of February. So that's huge. That's in the back of my mind. I want to get the business to a point where when
That's the
that
time frame you're
happens,
working against.
yeah,
Yeah,
yeah. So I feel like I'm kind of sprinting towards that. So when that happens, I can just chill,
enjoy
right?
it. Yeah.
And like let things run. So, you know, I'm excited about a lot of things. I'm really excited about our team. We've had a number of changes since we've implemented EOS, just getting the right people in the right seats, making sure we're all aligned on our values. But yeah, I think going forward, the biggest bucket that I'm excited about really is sales. I think there's so many things that we can do that we haven't done. I think with our new website that you guys are building, I think we're gonna do very well.
Yeah,
Our,
better
our
first
our
impressions was an old tagline that we had, but I think that's still what is delivered is a better first impression. Not everybody's going to go there and be like, "Oh my gosh, here's my credit card."
no, no,
They're going to be
right.
like, "Interesting. I like these people. This is what I'm look this
Yeah.
is the story, like everything about this resonates. I'm going to reach out." I always call it the first date tool because the sales team's got to close the second date, third date, so to speak, but getting someone interested to at least book a call, I'm excited about what's going to go live for you all.
Yeah, yeah, man. I'm super excited about that. I'm really excited about we've changed a lot of the programs that we offer. We've just simplified everything. For a while, we had too many offerings, too many plans. We were trying to be everything for everyone, and we're not doing that anymore. Which it feels good. It feels um, like we're all very aligned. But yeah. And by the way, I think your website tagline was like something about like being your best. Like your website should be your
Yeah,
best
it's
salesperson or something like
shifted a
that.
bit. I think it's gonna go used to be make better first impressions, then it was make your website your best salesperson. And
Yes,
now I think it's
exactly.
make it stupid simple for your future customer to find you, which is a little long. And I actually might be adding words to that,
Yeah.
but you get the picture. And I think we'll go through a little bit of a shift again, which I'm excited about. But
Yeah, but
website's
just
key to it. I think a lot of people just see it as a when you start a business and you go read a blog, like the 10 steps to start a business, which for whatever it's worth, one of the steps is always get a website. And I think that's the way most business owners see it. It's just a checkbox and move on. And that website gets used by everybody. And the old argument that I used to hear all the time is like, well, I'm not going to update the website. Nobody currently buys through it. Like nobody's ever bought to the website. So it is in a tool that works for us. And the argument always is you don't know who's come to your website, been like, they're not the right fit and bounced when actually you are. And websites are funky like that. You don't know who you're losing. You only know when it works, but you don't know when it doesn't work. And 9 times out of 10, I've always argued companies have left revenue on the table for sure. If you start to factor in deal size and traffic and visitors, it can be pretty painful to know that all those people walked through your quote unquote digital door and didn't buy anything. And I always say it'd be like owning a physical foot traffic store, like a shop or restaurant. and thousands of people walk through every month and like one buys from you, you wouldn't say that the restaurant doesn't work. You'd say, I got an issue about people sitting down and buying the thing, right? So 9 times out of 10, that's the real issue. So excited to solve that for you. But
Yeah,
if anyone
100%.
listens to the podcast, they know I'm passionate about it as well. So
Yeah, well, we're both very passionate about what we do. And uh, another thing I think that's really exciting, and you kind of mentioned this earlier about like our market being saturated. You know, when we launched this practice, most people didn't know what functional medicine was. Like even most doctors didn't know what functional medicine was. Now almost everybody does. And it's becoming way more saturated. And I think we are in the position where if we just button a few things up and we just lock a couple key strategies in that we're working on, that we have the opportunity to be like the practice of Denver. You know, right now, I think we are the most reputable practice in Denver that delivers functional medicine. But I just think like it's such an exciting time because people are becoming more and more aware of and accepting of what we do. And I mean, when I say accepting, that's kind of to me, it's weird that functional medicine even has a name. Like
yeah,
when you say treating the root cause of illness, that's functional medicine. Like that should just be medicine,
that should
you
just be
know?
medicine.
That should
Yeah,
just be medicine. It's so strange that you have to explain that. But I mean, even to this day, like if you Google functional medicine and you see what Wikipedia says it's based on pseudoscience, it's quackery. Like,
really.
and yeah, man. And if you look at the you know the thousands of patients that we've seen at this point for which we have changed their life, you know, that have gone to places like the Mayo Clinic, they've gone to dozens of different doctors and haven't gotten better, and have gone to us and gotten real answers. And then you see that, you know, it just shows you like what is out there and what people kind of used to believe about it. So it's an exciting time, and I think we're really well positioned, you know, largely through the help of Numa to be the functional medicine practice of Denver. So
Which is
there's a lot to
exciting
look forward
stuff.
to.
And that's a good note to end on, right? You started, not many people knew about functional medicine. Today I feel like that term is far more well known. Even the last 6 months it feels like. um what advice would you give to others that have something that maybe is a bit newer? It's a newer market, newer category that they think is going to grow. That's certainly a different type of business than me, me working into something that had already existed and people knew what websites and SEO and paid media were prior to us existing.
Yeah. Man, what advice would I give? That's a really tough question. You know, when we launched this practice, it was hard because it was like when you have an idea that not a lot of people are doing. I mean, for us, it was proven that it could work, right? Because there were functional medicine practices. But like you have this idea that you believe in, but then the question is, okay, well, but are other people going to believe in it, and are they going to pay you for it? And when you've got no reputation, like that's hard. But I think that if you're truly passionate about what you do and you know that it changes people's lives for the better, and you can talk passionately about it, and you can, you know, bring people in with like that energy that you show for whatever it is that you're working on, like if you can use that to get started and just get your first client in, like, you know, when we got our first patients, we would have like goals of like we'd have celebrations. So like at 5 patients, we like went out and like we framed these pictures that were expensive to frame. You know, at 10 patients, I can't remember what we did, but we you know we had these little, you know, these little milestones. And it's like if you can just get the ball moving forward, like starting is the hardest thing. And if you can position yourself in something that's unproven, like yeah, that might be the hardest to start initially, but the upside potential is way higher. So if you have something like that you know will help people, like that's really exciting. But you've definitely got to be in it for the long haul. And I think you have to really be able to communicate it very well.
I was going to say, I feel like you're building a business like yours that's newer in the industry. It's a show of faith of how important messaging, positioning, and knowing the why is, and knowing your story. Because I don't think I did that all that well. I kind of fumbled around, I'd say, for the first 12 months. But if you ask, do you know what a website is? Everybody's like, yeah, what are you talking about? Like, I know what a website is, right? There was
Yeah.
this underlying education. So where I could fumble into a market and find some revenue. But if I'm coming up with a new version of a website, I don't even know what you'd call it, a lot harder to fumble your way into success. But I think the other thing, and I totally agree with it, it's really hard to lose the game if you never quit, is the way that I say it, right? Like some of the people have asked me time and time again. I've been on podcasts as well of like, how did you start Numa? Like, what was your secret sauce? Is what they're asking. It's like, I don't know, man. I worked a lot, didn't quit, kind of closed my eyes, held on to the steering wheel, put gas pedal to the metal, and here we are. Like I think, it probably sells Newman and the rest of the team short for sure. But in those early days, it was just time and market and see how long we could survive. And suddenly started to click, and all of a sudden here we are. So I feel like that's half the battle of starting a business, is just sticking with it long enough to really have it grow legs and start running.
Yeah, 100%. And people look at, they look at where you're at and they have no idea what you've been through. Um, there was a lot of uncertainty many different times. There's been a lot of challenges. Um, but
It's
it's all
part of
worth
the
it.
fun of it, man. Yeah, I look back on those times, and knowing what I know now, maybe I wouldn't have gone all the way to the deep end as quickly, but they're fun times. Starting a business is fun if you enjoy some of the chaos, which I certainly do. So, Luke, thanks for jumping on,
Yeah,
man.
yeah,
If
of
people are
course.
local, where can they find you? But if people just want to kind of follow along on the internet, where can they find you?
Yeah, for sure. So we're just on the west side of Sloan's Lake by Edgewater Market. If you're in Denver, you probably know where that is. Our website is primehealthdenver.com. If you want to work with us, you can just click on that book a free consultation button right at the top. You can follow us on Instagram. We're Prime Health Denver, at Prime Health Denver. But our website is definitely the biggest channel. So look there. That's where you get the most information.
And if you look here soon, you might see a new one, maybe.
Yes, you will.
Luke, thanks for having me, man. Or thanks for jumping on, spending time
Of
with us,
course.
and excited to stay in touch and get the website live. And we'll have to do another version of this in the future.
Super down. Let's celebrate in the sauna.
See you, man.